Dago, Scano. Hello, everyone. This is Lori Davis-Hill, Incident Command for the Pandemic Response here at Six Nations of the Grand River. This is your COVID-19 podcast for September 25th to 28th. It all begins at the wellness area, so here we go. I would like to spend some time with a guest today who has some excellent guidance for us about a disorder that is often misunderstood. Please welcome Floretta Hill. Scano, Floretta, can you tell us about yourself and about your program?
Sego, Scano, Lori, thank you, I will. I've been employed for 21 years with Six Nations Health Services within the schools as an employee of Six Nations Band Council and Social Development Program. And then the name since changed to the Early Childhood Development Program / FASD. However, I've switched roles within the last year, and I'm now working as the FASD coordinator for Six Nations Health Services team at Six Nations Health Services at the White Pines Complex located in Oswego. I've worked with children with FASD that are suspected of FASD and or their families who have developed. I work with children, youth with FASD or suspected FASD and their families to develop a support plan based on individual strengths and needs and informed by the children, the parent, and the family, their vision, their goals, and their concerns, providing information to the community to educate on supporting, seeing FASD through the eyes of a child, youth, or suspected of FASD, and supporting the connections to diagnosis supports as available, and provide information to the families as post-diagnostic support. Supporting connections to other services, though, with consent, shared information and service plans, so the family doesn't have to repeat their story.
Can you tell us a bit about what FASD is and what you would be doing with people?
Okay, so fetal alcohol spectrum disorder, or FASD, is a diagnostic term used to describe the impact on the brain and the body of individuals potentially exposed to alcohol. The impacts of FASD are lifelong, but once we understand it and we add the tools into the toolbox, everyday activities can be made easier. Individuals with FASD will experience some degrees of challenges in their daily living and need support with motor skills, physical health, learning, memory, attention, communication, emotional regulation, social skills to reach their full potential. Each individual with FASD is unique and has areas of both strengths and challenges. So what is the definition of FASD, you ask? Well, FASD stands for fetal alcohol spectrum disorder. It is a lifelong disability that affects the brain and the body of people who were exposed to alcohol in the womb. Each person with FASD has both strengths and challenges and will need special support and caring, community help for them to succeed in many different parts of their daily living. A standard definition for FASD in Canada was released in 2019 through CAN FASD. The recommendations that researchers, policymakers, and service providers use this definition when they're talking about FASD. So, many people have asked me, Floretta, what's the difference between FAS and FASD? FAS stands for fetal alcohol syndrome. The term FAS was first used in 1973 to describe a specific set of birth defects that were caused by prenatal alcohol exposure. In Canada, we now use the term fetal alcohol spectrum disorder, or FASD, to describe the range of impacts that can occur in the brain and in the body of individuals potentially exposed to alcohol. FASD is more inclusive to a true range of strengths and challenges that can occur from potential alcohol exposure, where FASD or FAS only captures a small portion of these impacts. You may be wondering, what are these signs and symptoms of FASD? Well, FASD is a spectrum disorder, so it affects people in many different ways. Individuals with FASD are known for having a number of different strengths, including being friendly, likable, affectionate, determined, hardworking, forgiving, non-judgmental, and caring. They also experience challenges with learning, memory, attention, language, social skills, motor skills, reasoning and judgment, behavior, and or academic achievements. And they will need specialized support to help them succeed in the areas. So in their everyday life, these challenges may look like being impulsive. The executive function deficits also of individuals with FASD tend to show a higher rate of impulsivity and risky behavior. Impulsivity becomes a concern in young children and then continues into adolescence and then into adulthood, along with unpredictable behaviors. And risk-taking, risk or impulse behaviors may show up in many different forms in individuals with FASD. One example is running out onto the street. The best way to counter this is constant supervision and risky situations and repetitive rules to keep them safe. Not understanding consequences, like cause and effect relationships, can make it difficult of the FASD individual to learn from their mistakes or their past behaviors and consequences. The person may continue to make the same mistakes or the bad decisions over and over, much to the confusion and frustration of those supporting them. Being unfocused, easily distracted, difficulty keeping up with classroom learning, challenges handling money, challenges learning how to tell time, forgetting how to do something they've just done before, having problems staying organized or planning ahead. Each individual will experience different challenges, and their challenges may be different depending on where they are in their life. The signs and symptoms of FASD can overlap with a number of different developmental disorders, which can make diagnosing FASD very difficult. So, early recognition and diagnosis are the key to getting effective supports to improve the outcomes of these individuals with FASD. I have many parents ask, can the brain recover from FASD? Well, FASD is a lifelong disorder. There is no cure, but early appropriate supports can make a positive impact and improve the outcomes for individuals with FASD. So, how can you tell if someone has FASD? Well, that's a myth, that you can't tell if somebody has FASD from just looking at them. There are also no specific medical tests like a blood test that could tell us. In order to determine if someone has FASD, they must be diagnosed by a multidisciplinary team of experts. And in a very small percentage of cases, less than 10% of individuals with FASD have visible facial differences. However, the facial differences are rarely rare and have little or no impact on their day-to-day function. So they're not indicators of the degree of the challenges by someone's face, because a lot of people will say, oh, they have FASD, you can tell by looking at them, but you can't. It has to be done by a test. So what are the causes of FASD? FASD is caused by prenatal exposure, or PAE. People who are not exposed to alcohol during fetal development will not have FASD. I get asked a lot, is FASD preventable? Well, yeah, FASD is preventable if women do not consume alcohol during pregnancy. However, FASD prevention is very complicated. There are a number of reasons someone may drink alcohol during their pregnancy, including being unaware they are pregnant, having a substance use challenge, experience abuse or trauma, and not knowing the impact alcohol can have on their pregnancy. In order to prevent FASD, we have to consider all these factors that influence alcohol consumption, and we have to provide these supports for women and girls to overcome these barriers to health for a healthy pregnancy. When we say FASD is 100% preventable, we are oversimplifying this, an extremely complex issue. This statement has the potential for negative impact on prevention efforts by creating stigma that pregnant women who use substances have to overcome. When we talk about FASD prevention, we have to be very cautious in the use of language that doesn't promote a stigma or harm. When describing or defining FASD, the least stigmatizing approach is the emphasis taking away from the behavior of the birth mother and then shift the emphasis towards the substance. So I also get asked a lot, is there any amount of alcohol that is safe to drink during pregnancy? There is no known amount or type to consume alcohol during pregnancy. Experts that say that the safest option is not to drink alcohol if you're pregnant, breastfeeding, or trying to conceive. How can I get an FASD diagnosis? Well, if you are concerned that you are a member of a family that has somebody that has FASD, or you think, you can call me, Floretta, at Six Nations Health Services. I'll give you the number at the end of my little talk here. I can help you get started. We will first meet and I will get to know your family and your children. If you're interested in a diagnosis, I can help with that assessment process. Sometimes caregivers don't want a diagnosis, but just want support. I totally respect your wishes with that. I would like to work with you to achieve your goals. Also, I have a group called our Connection Group, which is a safe space for parents and caregivers to share their strategies, thoughts, feelings about raising a child with suspected or confirmed FASD. The assessment process involves meeting with a diagnostic team made up of several different professionals, including a pediatrician, psychologist, speech language pathologist, social worker, occupational therapist, and a clinic coordinator. When can you get a diagnosis? The diagnosis process for individuals with FASD can start at any age, but FASD diagnosis is complicated. Signs and symptoms are difficult to recognize in newborn infants and young children. So FASD often doesn't get diagnosed until the individuals are in school or they reach their teens. So this is an interesting fact, though, that many people may not know. If a man drinks, can his sperm cause FASD? Well, a father's drinking habits make a fetus more vulnerable to prenatal exposure, which is the PAE I talked about, and can contribute to the FASD. Fathers can have an important influence on the mother's drinking habits and the healthy development of their babies. Alcohol consumption in fathers has been associated with a higher level of alcohol consumption in the mother during pregnancy. Babies born earlier and weighing less, lower success rates in assisted reproductive treatments like in vitro fertilization or IVF, a gamete fallopian transfer, or they call it a GIFT, higher rate of malformation and abnormal brain development in infants. So we recommend that both father and mother stop drinking alcohol if they are trying to get pregnant or they're planning to become pregnant. Some people have asked me, Floretta, can your child get FASD if you use drugs during pregnancy? Well, FASD diagnostics term refers to alcohol consumption during pregnancy. Children of women who use substances other than alcohol during their pregnancy will not get FASD. However, there is a mounting evidence of struggles for a child who are exposed to other substances in the womb. In other words, using other substances during pregnancy is not a safe option for you or your baby. If you are pregnant or you're planning to become pregnant, the safest option is not to use any substances. Talk to your doctor, your healthcare provider, if you're using a substance during your pregnancy. So the other thing is, so why is FASD research important? Well, this is a disability. All FASD diagnosis can apply for disability. FASD is still relatively new in our field, and our knowledge and understanding of this disorder is rapidly growing and changing. Research is an important step to building a complete understanding of FASD. Research helps us develop evidence-based informed supports, services, policies that can help lessen the impact of FASD in individuals, families, and communities. In order to develop effective research, we need to ensure that the voice of all the impacted parties are included. That is why Canvas FASD has built a network of stakeholders from across Canada to help to inform our research at every step of the way. For support or information on FASD, you can call me, Floretta Hill, at Six Nations Child and Youth Health Team at Six Nations Health Services. Our team will guide you into finding help, the help you need, and I can be reached at 519-445-4983. Now, and thank you.
Yeah, Floretta, for joining us today. Your information is valuable, and your words about not creating stigma are very important to remember. We certainly appreciate all the information you shared, and we hope our community members will reach out and contact you for support. And again, Floretta can be reached at 519-445-4983. Stay well, Floretta.
Thank you.
Now let's turn our attention to the numbers. Over the past couple of weeks, the number of COVID-19 cases have been rising significantly. That's right, over the course of the last 7 days, the province have recorded daily new cases reaching over 400. Updating the current state in Ontario, there are 48,496 total positive cases. 41,866 are resolved. There have been 2,836 COVID-related deaths. This means there are currently 3,794 active cases of COVID-19 in Ontario, and of those cases, 88 have been hospitalized and 27 are in the intensive care unit. Here at Six Nations, we remain at the report of a total of 16 positive COVID-19 cases. 15 cases have resolved, and there's been 1 death. We currently have 0 positive cases. Having a look at our testing numbers, 1,834 tests have been completed. Of those tested, 1,739 are showing negative results to date. Michigan Public Health and the Assessment Center have directed 66 people into self-isolation at present while they await their results. Now over to the adjacent communities. Mississauga's of the Credit remains at 1 case reported, which is now resolved. Haldimand Norfolk Public Health Unit reports 489 total positive cases. 4 are active, 448 have recovered, and there have been 32 COVID-related deaths. Brant Public Health Unit reports 182 total positive cases. 13 are active, 164 are resolved, and there have been 5 COVID-related deaths. The Hamilton Public Health Unit reports 1,094 total positive cases. 73 are active, 975 are resolved, and 46 have been resulted in COVID-related death. And the Toronto Public Health Unit reports 17,971 positive cases, 1,267 are active, 15,526 are resolved, and there have been 1,178 COVID-related deaths reported. Here at Six Nations, Project Protect Our People requires all of us to do our part. That means upon your entrance to Six Nations, even if you are visiting from the United States just for a day, face masks must be worn in all public buildings, and there is a 14-day self-isolation mandatory for anyone crossing the U.S. border. This is why self-isolation is crucial to our community. Self-isolation means you have been told by Michigan Public Health or the assessment center to separate yourself from others, including from the people you live with, to the greatest extent possible. Going into self-isolation is not meant to be a punishment, but it is a precaution as COVID-19 spreads easily from person to person. Self-isolation is important for many reasons, the most important being that you could have the virus without displaying any symptoms and infect others without knowing. Since there is not yet a cure for COVID-19, preventing it from coming into the community by self-isolating is one of the most effective ways to protect yourself and your community. You go into self-isolation when you return from travel outside of Canada, if you have come into close contact with someone who has traveled outside of Canada, if you have been diagnosed with COVID-19, or if you have been in contact with a probable or confirmed case of COVID-19 without PPE and you are waiting for the results of a COVID-19 test. Also, please note that Six Nations is requesting that any unmonitored private gatherings are limited to the numbers of 10 indoors and 25 outdoors. If there is monitoring and screening of all attendees by staff or by an organization, limits are gatherings of 25 indoors and 40 outdoors with public health measures in place. Those are physical distancing, wearing masks, staying home when you're ill, and frequent hand washing. These limits will help us continue to help each other to continue to protect our people. The COVID-19 hotline remains open. As of this morning, Ontario Health announced that testing will now be limited to those who have symptoms, have a known contact with an identified case, and are part of a high-risk group, such as healthcare workers, education workers, cross-border workers, or first responders. Indigenous communities are considered high-risk groups and will continue to have access to testing. Testing here at Six Nations is available to any Six Nations community members with an appointment on Monday, Wednesday, and Friday mornings. The Six Nations COVID-19 Assessment Center can be reached at 226-446-9909 or toll free at 1-855-977-7737. And a reminder that this is for Six Nations community members only. As you have heard in prior podcasts about the importance of contact tracing, we are announcing the contact tracing app available. It's completely voluntary and collects no personal information. If you're interested, please find out more about this app at covid-19.ontario.ca/COVID alert. And in closing, watch for Healthy Six Nay and Six Nations Matters for ongoing updates to programming being provided in the community. You can also refer to the recently released Fall Leisure Guide for more information. Public Health would also like to remind everyone that they are ready to provide you and your child with immunizations, and they are preparing for this fall's flu clinics as well. Please call 519-445-2672 to schedule an appointment for your vaccinations. If you would like to connect with the Six Nations Mobile Crisis Service, you can do so by phone at 866-445-2204 or 519-445-2204. They're available 24/7. You can reach them by text Monday to Friday, 8:30 to 4 at 226-777-9480, or by live chat Monday to Friday, and that's found on the Six Nations COVID-19.ca website. Remember our frontline workers here on Six Nations and around the world. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Yeah.